Katherine Downing is joining us from AHIMA. She's the Senior Director for the IG Advisors for AHIMA. She's also probably has some stories to tell on the storms of Houston. That's not on the agenda, but I bet it's interesting.
We don't have time. Find me during break.
And AHIMA has done a lot of work on governance structures, and we're excited to have you here joining us, so thank you very much.
Yeah, thank you. All right, so what we're going to talk about is we're going to talk about AHIMA's framework for information governance, which is 10 competencies. We have a maturity model built. We have a tool that it's built in for you. But before we get to that, we're going to talk just a little bit about AHIMA's definition. Susan did a great job setting the stage for the definition. She gave you something a little bigger. I'm going to make it more concise. So we believe that information governance is an organization-wide framework. So organization-wide, meaning not just clinical information, not just health information managers, but truly organization-wide. And it's for managing information throughout its life cycle. So we have issues with data at the point of creation. We now have a 99% EHR, electronic health record implementation across the United States, thanks to some governmental incentives to get electronic health records going. But with that incentive, people were under a lot of pressure to get systems in very quickly. So oftentimes they went with what the vendor gave them, quite frankly, as far as templates. And so now you've got physicians who are kind of creating workarounds. And let me give you an example. I talked to a friend who's an orthopedic surgeon, and I said, I know you've done, an Epic implementation. I'm real curious about how things are going for you. Never, ever ask a physician what they think of the EHR. Or if you do, have 45 minutes for them to give you. But anyway, an example she gave was, one of the things we do as orthopedic surgeons is we do a lot of research. So we'll have different types of, new knee functionality, et cetera. We'll have, possible research activities going on. So we're always looking out for which patients would probably fit into this research study. But there's nowhere to put that in Epic, so what we do is we share notes on our iPhone, and when a patient comes through that would be a good fit for that research study, we put it in the iPhone notes. And we put the patient name and the account number and just some notes about why we think they'd be a good fit for that research. Okay, from a security and privacy perspective, any of my security people in the room, not gonna like that. It's also a problem from an information management perspective because it's all happening outside of any of the documentation we have in the organization. So all things like that are happening to us. So when we talk about life cycle, we're not just talking about analytics on the back end, we're not just talking about informatics, we're not just talking about record storage, we're talking about from capture all the way through to final destruction of that information. So that's what we mean by life cycle. And information governance in our mind needs to ultimately support the organization's strategy. It needs to reduce risk for the organization. It needs to protect the patient's information and secure it across the organization. So when we talk about risk and environmental requirements, we're talking about that too. So how do you get there? It's through standard policies, which Susan touched on, accountabilities for information, that's your data stewards, et cetera, that program, as well as the individual's responsibilities. Repeatable processes that your staff has been educated about, protecting information, and prioritizing investments. And that could be, do we still need to store all this paper off-site, or should we be scanning it in? So helping your organization prioritize those investments. Now, one of the things about information governance, when we look at it from our perspective, is that it is organization-wide, but it's also healthcare-wide. So when we talk at AHIMA about information governance, we make sure to say it's all of the information across your organization. This idea of siloing clinical information, it's got to go. We've got to talk about HR information retention, just as the same as we have to talk about clinical record retention, retention of accounting records, what you've got on your website. We have laws that mean we have to keep and retain our social media posts as part of federal law that we have to, in America, we have to keep track of that and keep it for a certain amount of years. So all of that has to come into play. So it's not just clinical information. It's all types of organizations across healthcare. So it's not just providers. It's all of our business associates as well. A lot of cases, we have information at the organization that will be put into a vendor system for release of information, for example. And so in the case of the Nuance hack, I don't know if any of you are familiar with that, ransomware took over Nuance's system, and almost every single hospital in America is with that vendor at one time, where they had our information. So we all have to notify all these patients and say, you know, there was a ransomware attack, your information was under the control of these hackers, they probably have it. We assume a ransomware attack is a breach because they have control of the data. Whether Nuance will ever get that data back, probably not. They're still at this point replacing servers. But that kind of thing is, again, it's all organizations across healthcare. So if we just protected it within our four walls, we're not doing our job. The health plan has to do it. The Health Information Exchange networks have to do it. The State Department of Health has to do it. So across all of healthcare, it's all types of information and all media. So when we say information governance, we're not just talking about electronic records. We're talking about what's off-site in storage. We're talking about what's on different systems that are legacy systems. Legacy systems, again, a big security risk for us, because if you have a legacy system where the vendor is out of business, or the vendor that product is out of service and no longer taking security patches, we've got issues. So I have people come up to me all the time, through acquisitions and mergers. We are managing 35 different clinical systems. And we can't figure out how to get out of this business of maintaining all these legacy systems. It's super expensive. It's super risky. We have to back it up. We have to have disaster recovery planning. It has to go in our risk assessments. Really big deal around all the data we've got. But information governance is all information. So AHIMA, the American Health Information Management Association, has been talking about information governance and bringing it to healthcare since 2012. And the reason is, with the advent of the EHRs, we see the roles for our HIM leaders across the organization shrinking. And we want a future for our health information managers, and the future is information governance. Again, getting out of just responsibility for clinical information, getting out of responsibility for just the paper things that need to be handled. We want to go bigger, and so that's why we're doing all this education. Over the last few years, we've released the Information Governance Principles for Healthcare. And we released those back in 14, 15, and then our members didn't really do anything. They thought, okay, this is great, we've got the principles, but nobody could operationalize the principles. So now we've really taken it down the road with the release of the Information Governance Adoption Model for Healthcare, which I'm going to show you today. So based on Susan's presentation and my little overview of IG, I'm just curious, by a show of hands, healthcare has been talking about IG since 2012, but I really don't understand what it is. It's okay if you raise your hand? Okay, good. I understand what IG is, but I'm not yet able to apply it in my organization. Some of you probably, okay, that's fair. Or I understand what IG is and I've started work. I've got things going. I know that at least Kathleen can raise her hand. Several of you, good, okay. So we'll take a little bit of a deeper dive, but we are seeing some really rapid success with the use of our IG adoption model for healthcare. Now, I know Susan mentioned a couple of IG models that in her previous presentation. We are the only one that's specific to healthcare. Why do we need one for healthcare? Why can't we just go out and use one that's for the finance industry or for banking or for the military? They don't really adapt well. In healthcare, we have so much more data that isn't discrete. So when you think about banking, there's not a lot of physician notes or scanned documents. We have a lot, we're kind of in that hybrid stage still in healthcare, so that's why we believed that we needed a governance model specific to healthcare and a framework specific to healthcare. And this is it. So AHIMA's IG adoption model is based in these 10 organizational competencies. And under each of these competencies, I will show you our markers of information governance maturity. So let's start with what these competencies are, and then we'll talk about what's under them. So starting with IG structure, Susan touched on it. You need to have a structure, a committee of some kind to organize, to make decisions about what you're going to do during your information governance program implementation. Also, your stakeholders are in the mix as it relates to the IG structure. Next is strategic alignment. We really want you to align your strategy with, I'm sorry, that's going off the screen, with your needs of your organization, so with the strategies of your organization. So you're gonna have a lot of IG projects, but you're gonna want to start with the ones that make a benefit to your CFO, your CEO, your patients, so that you can keep the project going. We also want to see cost reductions, things like that. Enterprise information management, you're most familiar with because it's taking our jobs as information managers just a little bit further as it relates to life cycle, record retention, destruction, preservation, et cetera. IT governance is something you're probably familiar with. So it's purchasing IT systems as well as change management, some of those types of activities under IT governance. Data governance, Susan dove into this. This is your stewards. And we'll talk more about that, data quality. In order to be able to use information that you have, you're going to have an analytics program. So that's a key competency. Privacy and security, we have to keep our information secure, protect all that information. Legal and regulatory, we've got e-discovery requests, other legal requests coming in. And then the last two, awareness. Let me give you just a little story about awareness. So we have an organization that we've been working with. They've been doing information governance for about 3 years. Great committee, really getting stuff done. But they'd never done any education for anybody outside the committee. So when we walked them through the model, they said, gosh, you know, we've spent 3 years doing data governance, we've got good IT governance, but it never occurred to us to train the workforce about information governance, about their responsibilities. So they were just kind of doing it at the management level, leadership level, but not really taking it down a level. So that's where you get into awareness and adherence. And then the last one is IG performance. So once you have an information governance program in place, you're going to need to be checking on its performance. Are your policies being followed? Is your staff really aware of information governance across the organization? So why bother measuring your maturity? The reason you're doing that is so that you can figure out where to start. Because as Susan mentioned, information governance is a multi-year project. So you really need to figure out what you're good at, and there will be things in the model right away that you're going to be a level 4, a level 5 on, good to go. And then there will be other sections of the adoption model where you're like, oh gosh, we're a 1 on this. We've never done anything with this maturity. And what the model does then is it creates your roadmap. So I'll show you some of the reports. You compare yourself to peers, et cetera, in the model to kind of give you a place to start. So where did the IGAM, the Information Governance Adoption Model, come from? Like I said, we started with those principles and we just didn't see people moving them along. It was confusing. It was like, okay, we know we need to protect, we know we need to have integrity, but what are we supposed to do? And so that is why we worked with a large group of different types of organizations to really create the pathway. So it's a 5-level model with the starting point being, you know, you're at risk, you're maybe doing some things around managing this sort of information, but you're not really fully engaged. At level 3, it's actualized, and at level 3, you're aspirational, so you know you need to do something. And then at level 5, it's actualized, meaning you're doing it, you're making changes based on it, your staff knows about it. And of course, they're all A's because we're AHIMA. So you can imagine us trying to come up with 5 A words for 5 different levels, the things that drove us crazy during model design, right? So what do you do with the model? You know, Susan mentioned you've got to bring a team together. And so what we do is for each of the competencies, we have recommendations of who you need to bring together to kind of walk through the competency. This is not something that the health information manager is going to sit in their office alone and guess at. It's going to take a group. And the thing about bringing the group together is it's the light bulb goes on. I mean, you will just be amazed when you sit down with a team and you start talking about your maturity level. If you're looking at privacy and security, you've got your privacy officer in the room, your security officer, your compliance officer, your CIO. You're starting to have some of those conversations about what you're good at and then what maybe you know you need to do but you're not as good at. So we have recommendations based on competency about who needs to be at the table. Now certainly, we never recommend that you create, I was a hospital executive, never in any stretch of my imagination am I going to say create a new committee. Nobody wants a new committee. But you've got a committee with the right people. So the fun of the model is you just come in, you say, I need 30 minutes of today's meeting. We're going to go through and we're going to measure our maturity and we're going to see where we are. And the fun part is, if you're, let's say you're doing analytics and you've got your key, your analytics, your business intelligence people in the room, and then you've got your operators in the room. The most fun is when you get to sit back and watch them argue, because analytics will be like, we are a level 4, and the operators will be like, I don't know what you're talking about. We would say level 2. Or sometimes the clinical people will say, yeah, I think we're a level 4 on that, and then HR will say, yeah, you guys have it maybe for the clinical side, but we're like a level 1 when it comes to being able to do that kind of reporting in human resources. So it gets the conversation started. The light bulb goes off, and you're not the bad guy because all you're doing is bringing the conversation to them and kind of going through and figuring out where you are. And if you're a level 2, it's not the end of the world. You can decide based on all the level 2s and level 3s and level 1s where you want to go next. And this will all make more sense when I get you in there. So it's meetings to discuss each of the 10 competencies is sort of our best practice. Then you get your score. And then you've got your roadmap. So you decide how to prioritize from there instead of trying to figure out the whole piece on your own. So with that, let me jump over and get in the system itself so that you can see what I am talking about. Get rid of these. Everybody's got their stuff open here. Oh, now where to go? There we go. All right, so this is IG Health Rate, which is our information governance adoption model for healthcare. I think it probably logged me out. One of the things is when we originally started with using Health Rate is we were trying to charge a license fee, but thanks to the help of vendors in our community, and if any of you are vendors and you want to join us, we've been able to offer it for free. And we're not announcing that till our convention, which is in 2 weeks, so you're actually ahead of the curve. We're launching it at convention. I don't know if maybe your connection is off. Yeah, it looks like the internet is no longer connected, so maybe it logged you out. Oh. Try that. Typing and talking. Yeah, it just needs to get, it wasn't on the internet, that's why I wasn't giving me anything. There we go, now we're back. All right. It remembers my demo. Okay. All right, so I mentioned as it relates to getting started, we've got the documentation there about who should be in the meetings. The levels are here. Each of the competency overviews that I walked you through on that slide with all the different circles going around are also here. And then the other thing the system gives you, which we'll see when we finalize an assessment, is coaching. So one of the things that we wanted to make sure that we did was you get this roadmap and we wanted you to know what to do next. And so in your report, you can turn on or turn off our coaching recommendations as to how to get started. So let me go back into assessments. And I'm just, because we were talking a lot about, through Susan's presentation, about IG structure and data governance, I'll jump into those 2 competencies, but I'll just give you an idea for each of the competencies, what types of maturity markers are in there. So you'll see I've got IG structure highlighted on the left side, and there are markers of maturity for things like, do you have an executive sponsor? And when you hover over the marker, it gives you some additional information to define it. And so we have data stewards and data owners in the system defined. So I thought it'll be fun to look at those. But the idea is that while you're working with your group, if they're like, okay, what are we measuring here? You've got that information sort of at your fingertips. And then you, with your group, you literally walk through each of these and decide which level you are. So right now, if I asked you at level 3, organizations, senior leaders embrace IG as a business imperative and have initiated a formal IG program. Would you say you were a 3? Would you say you were a 2, which is more like the senior leaders recognize the need for IG and have committed to initial readiness assessment perhaps, but they aren't really there yet? Or are you a level 5? We have an IG leader at the C-suite level, and we've got IG accountable to the organization's governing body. So you are where you are on the list, and maybe you'll never get to a 5, and that's okay. We also talked about IG committee. So again, we've got a definition of what we're looking for there. And then at level 3, for example, you've got a centralized, multidisciplinary stakeholder committee for information governance. That group has been established. They've gotten some level of training, guidance. They're getting started. Or a level 1 you haven't started, or a level 5, it's really going and you've got projects where you're seeing a return on investment or where you're seeing project completion. So for each of these markers, and there are 80 of them across the 10 competencies, not evenly distributed by any stretch. Some of the competencies like enterprise information management, it's a bigger competency. It's got things like record retention. Do you have, how are you classifying data? How are you calculating total cost of ownership for systems, things like that. So if I go down and I just click on the record retention and disposition marker, you'll see, again, it's defined if I hover over it. And then the levels. So, at level 3, you've got a formal retention policy. It reflects the, whatever rules and requirements that you have as it relates to record retention and so on. So each of the maturity markers you're going to be talking about as a group. Again, you can't do this in a vacuum. So it really does take a committee to kind of define. I wanted to also go into data governance because we did get into the discussion about data ownership versus stewards. So at our data ownership level, level 3, the issue of data ownership has been addressed and best practice methods are being studied and adopted. A plan to engage and educate business and process owners, so that's the education piece that Susan mentioned, and the communication piece has been initiated. The organization begins to formalize enterprise data rules, policies, processes, decision rights, accountabilities to clarify the desired state for data ownership. Data stewards are different from data owners. The data owner may more likely be the department head, where the data steward is going to be the SME who really knows what all those data fields are, how they're defined. So at level 3, a data steward is empowered to enforce the data discipline and serve as a conduit between the business, that's your communication route, between the data owner and the IG program as well as the IT program. Key performance indicators are developed at level 3, et cetera. So through each of the competencies, you're measuring where you are. And like I said, you're having the conversation with your team. So it's not like you're guessing in your department by yourself, or you're just looking at this from the health information management perspective. It really is to get the conversation going with different areas. So if you think about this, you'd probably want IT in the room. You'd want health information in the room. You probably need somebody possibly from HR, so clinical areas, et cetera. So it's some of the groups are bigger and some of them are smaller depending on what you're talking about. If you're talking about legal and regulatory, it may be a small group with IT, HIM, legal, et cetera, your legal counsel. And sometimes you go through and there's the ability to make notes at the bottom. So you may go through and you say, we've got everything in level 3 except this one piece. And you can only get to a level 3 if you have everything in level 1, 2, and 3. So you kind of have to force that discipline on yourself. And you also have to say, how are we assessing ourselves? If we really are truly assessing organization-wide, then maybe we can't really get to 3 because for some of our areas, our different verticals, we're there, but we're not there for all of them. So it allows you to have that conversation. Now, you could certainly go through and do an assessment called our clinical systems assessment and then just talk about your clinical systems and measure it that way. But obviously, our best practice is going to be to have that more global view. So like I said, there are 80 markers throughout the different competencies. Some of them you'd be more familiar with. If I go to IT governance and I talk about change management. So if you're implementing a change across your system, what is your process? Do you make sure your end users know? Do you test your system changes in test before you put them into production? All of those sort of basic IT management things you would assess. So why does that relate to information governance? Have any of you ever gone live with a system where you didn't properly test it and you have data issues or corruption, or you have to go back to a backup? It's an information governance issue, right? So we're not stepping on the toes of IT by asking these questions. And if IT is a level 2 on this, that's okay. It's going to give something for them to work on. Maybe they aren't where industry standards should be. And that's true of patch management and all the security issues that we see. You know, we're going to ask, how aggressive are you at staying, you know, online with patch management, et cetera, as well as email policies. You know, one of the key areas a lot of organizations need to start information governance with is, why are we retaining all of our email together? Healthcare is so bad about wanting to keep everything forever, but do we really have to do that with email, or do you have more legal risk if you keep it all when you could have destroyed it? So email is in here, social media is in here, mobile devices are in here, of course. We have a lot of risk with mobile devices and medical devices, et cetera. So any questions about this before I take us into some of the reports? Okay. So you've gone through at this point, and you've assessed everything, and you've answered all the questions, and now we're going to look at one of the demo system reports. So from the summary level of the report, I can see that this organization, if you do our secret sauce, each of the competencies is not weighted evenly. What did we do? So level 2 for this organization is their baseline score. Generally, we see for hospitals 2, maybe 2.7, something like that, into the 3 range for their first time through, before they've done the deeper dive. And then across each of the competencies. So this organization at IG Structure is a level 1. They probably don't have a committee. Maybe it's their first time through, so people haven't been trained, et cetera. Where they're a level 4 for regulatory and legal. So they've got, you know, sort of their act together maybe around e-discovery, around mandatory reporting to your providences, things like that. And then some 2s and 1s. So certainly, as this is their first assessment, their initial assessment, that's fine. But the idea here is that quickly you can talk to your team and say, when we talk about starting information governance, maybe we can start with some of these 1s. You know, maybe we start with creating the structure. And then as you move through the system and use it several times, you can start comparing your baseline, your initial assessment, to other assessments. Before I leave this page, the other thing that the system allows you to do is compare your score with other peers. So we would have a peer group that is Canada. As more and more of you use the system, we have to have enough of you to make sure your information is secure. But as soon as we get enough peers, then you would be able to compare yourself to peers. So right now our peer groups are things like, I want to compare to other children's hospitals. I want to compare to other state departments of health, other health information exchanges. I want to compare to large university hospitals. We have several large university medical centers, and they really want to compare to other large university medical centers because they've got a little bit more complexity. Sometimes they're a little more advanced, honestly, when it comes to data stewardship and things like that, because they were doing it at the university level. Because again, information governance is new to healthcare, but it's been going on in other areas for 10, 20 years. So the university may have started information governance before you even heard that it was going on. So sometimes they're a little more advanced and they want to compare to their peers. And so that's where that peer comparison baseline comes in. And then you'll see my red line is the baseline, but the next time I do an assessment, I'll have a current. So I'll be able to watch where I started and then how we're doing and what areas we're focused on, and that's by competencies along the bottom. So then, if I want to go in and get more information about some of these areas where maybe we scored ourselves and we want to see what the scores look like. So if I click on, in this case, Enterprise Information Management, for each of those markers, it shows my current level and what that level means. Now, I mentioned coaching. So if I click on Show Me the Coaching view, that's where you get into, for organization and classification of information and records, we're a level 2. So the coaching is going to say, here is what you need to do next. You need to, start a process, blah, blah, blah. So it goes through, for each of the markers, the coaching, if you turn it on, it'll show you sort of your steps, what your team should be looking at next. Now, one of the things about the coaching is it gets shorter as you get further along. So if you're a level 4, your list of to-do things is a lot shorter than if you're a level 2. But right now, if I'm a level 2 and I print out the coaching report, it's probably 80 pages of to-do items. And you can't do everything at once, so you're really going to have to work with your team to prioritize. Some organizations that we work with like to create subgroups of the IG committee to sort of work on different competencies, but we recommend you start with one. I'm afraid if you try and do everything all at once, that people are going to get burned out. I think it's better to say we're going to work on a competency, IG structure. We're going to work on data governance. We're going to work on a competency, and maybe, and the markers in there, maybe just some of the markers, so that you don't get yourself into a situation where you can't get anywhere and then the thing fizzles out. We've all been on projects like that. Which actually brings me to just one more point as it relates to your roadmap. The system is going to give you your to-do list. You're going to have to shrink it down. And during your discussions with people, you're going to find some low-hanging fruit right away. Somebody's going to say, oh my gosh, we've been needing to do that for 3 years. We should do that right now. So there's a lot of things like that that just come up through conversations that somebody just needs to, analytics policies is a good example. Sometimes organizations have written policies and procedures for a lot of things, but not really about who should have access to analytics, who can request reports, who can write reports, what types of information. So things like that, oftentimes you can kind of just get checked off the list. And then there are other areas where it's going to take a while. It's a bigger project. So what I'm getting to here is if you have a project management office or if you have project managers for some of these bigger projects, let's engage project management. I'm a project management PMP certified project manager. And the reason I like to have a project manager involved is when I'm leading a project, I don't want to be the bad guy on when somebody doesn't get something done, and that's what the project manager is for. So these projects are often big enough that they need to fall into your project management process, okay? So it's not the group, you don't want your group, like I said, to get overwhelmed by the amount of stuff that they have to get done. So like I said, each of the areas that you look at, whether it's privacy and security or analytics, the coaching can either be turned on or turned off. And when I know I have something to do, the coaching will be there to sort of guide the organization. So when Susan was talking about, develop your framework, what we didn't want to do is have each organization trying to develop a framework. So we have developed it. Like I said, we've made it available free to healthcare, to providers in healthcare with the help of some sponsors so that we can keep the system up and going for organizations. So any questions about the system itself before I click back into my presentation? All right, let me go back there. Yeah.
How do you decide at what level you want that system done? And by that I mean, is it at the one primary care office? Is it a hospital? Is it a health authority that brings several hospitals together? Like, what's the right level?
So we do have what we call parent-child built into the system. So if we have, we have many organizations that have 36 hospitals or 11 hospitals. And so what the corporate office usually does is they set up a parent-child relationship where the corporate office is set up, they do an assessment, and then each of the 36 hospitals will have an assessment. And they often like to compare hospitals versus hospitals in their organization. And let me give you an example. I did an assessment with a large corporate office in Nashville, Tennessee. They've got 16 hospitals. And I was talking to them about business continuity and disaster recovery. And at the corporate office, they're like, yes, we're a level 4 for business continuity. We have, let me pull it up here just to kind of show you. That one's under. And we've implemented policies and procedures, and we've got everything we need related to business continuity and disaster recovery. We have a hot site. We're good to go. I go out to one of the hospitals actually in the Houston area. Now think about what we've just been through. And I say to them, what is your business continuity and disaster recovery plan? And they said, well, we know corporate has one, but we've actually never seen it. And I'm in the room with the CFO, CIO, HIM director, compliance officer. Well, let me tell you, if you have a business continuity and disaster recovery plan and it's on the SharePoint site at corporate, but you've actually never seen it or trained your staff, you don't have a business continuity and disaster recovery plan. So what that does for corporate who, if you're corporate, if you're over a province, you often think that the stuff is going down to the local level, but this assessment can also kind of expose some of the areas where you issued a policy, but nobody's really fully aware of it. And in the case of a DDoS attack, a denial of service attack, you have no way from your hospital to be able to get up to those policies that are at corporate. Do you know what I'm saying? Because there's no internet. You're under attack by hackers. So the concept of, somewhere out there, on the World Wide Web as a policy is not going to fly unless you're going to be trying to look at it on your phone because you have no service in your hospital because you're under attack. So those things have to be practiced. And so, our higher levels would say, you've got it, it's practiced, people know what to do, it's been disseminated, there's awareness. But unless you do it at the hospital level, unless you get down to the hospital level, you'll never know because corporate thought they were a 4 or 5 in all those areas. And sometimes it's kind of hard to actually see what's going on out there because you're like, oh boy, maybe we thought we did a good job rolling this out, but it's not actually at the local level. So that comes up in several, but that's just an example I can give. Now I do have hospitals who own physician practices. So let's say I'm a children's hospital, we've got a couple of hospitals under children's, and then we also own 100 physician practices. What I've never done is gone into the physician practice. And again, I think they feel like they've got enough to do at the hospital IG program right now. They're going to get it in shape, and then maybe they'll start talking to the physician practices. But again, if you talk to those physicians, whether they're owned or on their own, they're using the hospital systems. There was just a breach in the news in the US where the physician office staff was fired, let go, and the physician never told the hospital IT. So this staff user for 13 months had access to the system, and they were selling patient data for 13 months, and the only reason the hospital found out is somebody in IT said, why does this physician office staff member access 26,000 patients last month? That seems kind of high. Well, yeah. And for 13 months, nobody turned off their access, nobody turned it off. The physician, he got mad, fired somebody, and never told IT. And the problem I have with it is that the hospital got the $3 million fine for not turning off the access. To me, it's like he's a covered entity. He's the one who didn't tell us. He should be fined. The physician practice, I mean. But it was the hospital that got the big fine on that, which I'm kind of like, well, I guess they should have known, but I don't know. If you only send out to get a signature for access once a year, it would take you a year to figure that out anyway. So I kind of felt like the physician should have been in on that show me the money. So any other questions? Like, that was perfect. So yeah, absolutely. Okay. Get rid of this from here. Okay, so I hope the competencies make sense now that you can think of maturity markers under them. There's 5 maturity markers under IT governance, but 13 under enterprise information management. So it's just depending on what we have to track and keep track of under each of those. In the presentation, since you don't have access to the system, I put some of the markers, just in case you want to go back and talk about this with your team. Do we want to ask Kathy to get access to the system? Is it something we want to use? I wanted you to have just a couple that you could show. Identity management is another one, IT governance. So again, if it's something that you want to talk about with your leadership team and see if it's something you want to engage with, I put some examples in the presentation. And then I also put the report that you get inside of the presentation. So where does the coaching come from? It really comes from industry best practice. It really is meant to be, a way to get your group started with like, okay, so now what do we do? And then some of it does tie back to AHIMA body of knowledge. So as we start working with your organizations, if there are some body of knowledge that we need to be connecting you to, we can certainly add that in as well. You turn coaching on or off, like I said, depending on how long you want the report to be and who it's going to. You get your score. You figure out what you want to do first. So that's your roadmap, your goals. You complete some goals. You go in, you copy the whole assessment forward. You change the 2 or 3 markers that you've had an effect on through your work, through your committee's work. You rescore. So it only really takes about 5 minutes to reassess because you're just changing the markers that you had an impact on. And then you could see if you got to move anywhere. And organizations will say, oh, I updated 2 of the markers and I went from a 3.1 to a 3.2 because they don't know the secret sauce. They don't know how they're getting scored. So we have a lot of tools and resources we've been offering to our members. And one of the things that we offer is this IG for Executives video. Because whether you have an understanding of information governance or not, sometimes going to have that conversation with your C-suite can be kind of like, oh, I don't feel like I know enough to be able to get it into that 3-minute conversation. So the IG for Executives video, it's like I said, 3 minutes. What is information governance? Why is it important to our organization? And then if somebody wants to interact with the video specific to their work that they do, it allows them to do that. If you go to IGIQ.com, that's our one-stop shop for everything information governance. So know your IGIQ. Our blogs are there. We do monthly blogs, the journal articles, case studies from successful organizations get published every single month. All of that is at IGIQ.com, and so is the video. We have a lot of things like white papers. AHIMA is releasing a 2017 information governance white paper at convention. So those types of things will also come through at IGIQ.com, as well as some of our other resources and tools, things like that. So our success stories, like I said, every single month, we work with organizations who are successful in many different areas. So whether it's data governance, IT governance, enterprise information management, we write up their story, what they did. And I'll give you an example, just really innovative things people are doing around information governance. I've got 4 minutes. One of the things that you're going to do during an information governance, data governance program startup is what we call an information asset inventory. Because a lot of times you've got all these different systems, they've got different information in them, but nowhere is there one place where you can say, what are all of our systems? What information is there? Is this a source of truth? Who has access to it? So creation of an information asset inventory is a pretty big project, but it's super important because now you've got all of your information assets listed in one place. And it can be in a system or it could just be in an Access or Excel. Well, one of the universities that we work with thought, you know what, we have students coming through HIM for their internship. What a great project for them to go out and interview every single department, interview radiology, interview the lab, interview all of the departments about the systems they have, what type of information is in the system, where does your system interface to, who has access to it. So it gave these students great exposure across all different department heads, all different types of information, and the students created the information asset inventory draft. And it's, like I said, it's a huge project, but they thought, let's do it with students. And so we wrote that up as an example of a case study. We also do blogs. We just had Health Data Management pick up one of our blogs last week about electronic health records and integrity. So, again, those come out pretty regularly. You'll see that. And the other thing we do at IGIQ is a lot of times there's interesting information governance stories in the news. And our news feed will pick up information governance from around the world, different projects, healthcare. We try and kind of weed out the others. But again, good stories in the news feed if you're willing to if you're interested in just looking at that. The other thing AHIMA has done is this is our 3rd year for a revision of the IG, the Information Governance Toolkit for Healthcare. Has anybody downloaded that? So that toolkit includes, sort of all of the basics for getting started with an IG program. What a charter looks like, what your committee should look like, what are some sample people that should be on the multidisciplinary committee, what does an IG job description look like? We're seeing more and more job titles, information governance coordinator, information governance director, chief information governance officer. So we kind of pull those together and share them in this, as well as the case studies, like I said, the monthly case studies that we've been doing for about 2 years, all in the toolkit. So that's something you go to IGIQ.com and you can get to the toolkit. So yeah, I think that's it. Any other questions before we go to break? I've certainly got my business card, so if you're an organization that's maybe interested in trying out the IG Health Rate Maturity Assessment, talk to me and I'll make sure we get you started. So thanks for having me, I appreciate it.
That was quite fast and incredibly informative. Do we have a question or two, or do you want to wait until we're on the panel and such? Kathleen, you have a question? Come on back up, Kathleen.
Kathy, I'll just remind people that there is an Information Governance Practice Council.
Yeah.
And I had the privilege, actually, of co-chairing with some of my AHIMA colleagues for the past couple of years, but they're always looking for members, and there's many different communities of practice, so that's just another plug.
Yeah, we've got 2 call for volunteers open at the ahima.org page. One of them is we're having an Information Governance Institute next year at convention, so we're looking for people for that as well as the Practice Council. So yeah, we'd love to have you. Who else? Yeah.
Hi, I'm just wondering how closely the information governance structure that framework that you guys have created, how it aligns with ARMA, because ARMA had already had a governance.
Sure, yeah. So ARMA's is not specific to healthcare. We didn't align with them at all, actually. ARMA's is the sort of the competency-based. It's generic in that it's for banking, finance, military, et cetera. Ours is very specific to healthcare. So it talks about, do you have a patient portal, and what information are you providing to your patients? How do patients request access? So ours is very much specific to healthcare, and we didn't work with ARMA on it at all. Yeah, it was just with our committees. Who else? Yeah. Yeah, sure. So when we talk about data ownership, we're talking about the business process data ownership. So it's more, I get what you're saying, certainly. But the difference we're trying to make there is really what Susan was trying to make, which is steward versus owner. And so, ultimately, we would say the patient, it's their information, et cetera, but we still have to be responsible for it. And so, who decides, what should the access be? How should we be doing analytics on this? That's sort of in combination between the data steward and data owner. But yeah, I get what you're saying, for sure. And like I said, I'll be available during break. Anything else for this group? If not, you can come get me and ask me questions during break. Appreciate it.
Thanks again. Thank you. Thank you very much. Well, the bar has been set very high for the rest of the day.